A very good morning to all. I'm Dr. Subashini Ambigapathy, and I'm the Family Medicine Specialist practicing in Klinik Kesihatan Buntong, Ipoh, Perak. Today, I'm very happy and proud to share the success of innovation project of my Q-CIG, a comprehensive and updated quit smoking record book used in quit smoking clinics in Perak, Malaysia. Together with me, my innovation project members would include Dr. James, Mr. Surendran, Dr. Gogi, and Puan Uma Mutu, who is my nurse, and we all work in Klinik Kesihatan Buntong. Ladies and gentlemen, tobacco use is the single greatest preventable cause of death in the world today. The projected global tobacco-caused deaths are mainly neoplasms, followed by respiratory diseases, cardiovascular diseases, and others. Malaysia is committed to achieve its WHO Global NCD target, which is to reduce national smoking prevalence to 15% or less by the year 2025 using the Empower strategy. The O, Offer Help to Quit Tobacco Use component of the Empower strategy is implemented through smoking cessation clinics conducted in all government health clinics in Malaysia, which includes Buntong Health Clinic. The Quit Smoking Clinic in Buntong Health Clinic has been very active since the year 2014. Throughout the years of running this program, the team found that the previous record book produced by the Non-Communicable Diseases Division of Perak State Health Department in 2010 was incomplete, had redundant columns and pages, as well as did not incorporate the pharmacy's quit smoking record sheet from the Garis Panduan Pharmacoterapi Berhenti Merokok, Bahagian Perkhidmatan Farmasi KKM 2012 into the same book. Both records by the doctor and pharmacist included similar information and duplication of data, which involved longer time taken for documentation. The compiled records also appeared to be messy, bulky, and occupies much space in the record room. As such, the quit smoking team of Buntong Health Clinic initiated My Q-CIG, a new and updated version of quit smoking record book, merging the doctors and pharmacists' documentation into one record, which is more comprehensive, relevant, and user-friendly. Thus, our objectives were, number one, to update the previous quit smoking record book in order to make the new book more relevant, comprehensive, and user-friendly. Number two, no data duplication recorded in the quit smoking record book between the doctor and pharmacist. Number three, no time wastage for data recording by the doctor and the pharmacist into two different records. Number four, minimal cost of production leading to overall cost savings. And lastly, to save space for storage of records of data of the quit smoking service rendered in the clinic. This is our methodology, ladies and gentlemen. In the month of January 2019, our research team was formed, the research idea was established and discussed, and permission was obtained from the Perak State Director of Health as well as the Kinta District Health Officer. Between February to April 2019, the old book was edited and revised, the draft of My Q-CIG was produced, the draft was updated, and the first prototype was produced. Between May to June 2019, the final copy of My Q-CIG was produced. In July 2019, these copies were printed and distributed for use by Perak State Health Department to all districts in Perak. Between July to September 2019, we started using My Q-CIG in our quit smoking clinic in Buntong Health Clinic, and between October to November 2019, data after using My Q-CIG in our clinic from July to September 2019 was collected and analyzed. Between December 2019 and March 2020, the final project report of My Q-CIG was completed, and we obtained the copyright for My Q-CIG on the 3rd of March 2020. In April 2020, My Q-CIG was distributed for use by other private agencies, which included KPJ Hospital Ipoh, Hospital Pantai Ipoh, as well as UITM Tapa Perak. This is the picture of the old quit smoking record book 2010, ladies and gentlemen. And this is the picture of the front cover of the Buku Garis Panduan Program Pharmacoterapi Berhenti Merokok edisi pertama 2012. And this, ladies and gentlemen, is how our copy of My Q-CIG, the new book for our quit smoking record, looks like. These are our results, ladies and gentlemen. Firstly, on page 1, a source of reference of column was added because this will enable the team to know where exactly the patient was referred from. On page 4, we added the Prochaska stages of change of model, which was incorporated in Appendix B, page 94, whereby we now have detailed explanation on what contemplation, preparation, action, and maintenance phases are. We also added a column on quit date, and we also added another column on the exact date the client had stopped smoking. We move on to page 5. Under medical history, we eliminated the column for smoker and we replaced myocardial ischemia with ischemic heart disease. We then further added columns for psychosis or depression, which is important to determine contraindications for treatment regimes when we are managing our smokers. We also added columns for asthma or COPD, drug and alcohol addiction, as well as for drug allergies. Moving on to general examination, we added column for BMI, and under medical examination, we added columns for pulse rate, chest X-ray, peak expiratory flow rate, as well as a column for serum creatinine levels. We eliminated estimated blood level COHB and actual blood COHB and replaced with expired carbon monoxide reading. Under the part for treatment, we added columns for types of medications which included varenicline, nicotine patch 5 mg over 16 hours, 10 mg over 16 hours, and 15 mg patch over 16 hours. And we also added the word gum next to nicotine 4 mg and 2 mg. We also added another new column for current medications taken. Page 6 was eliminated totally as this was the page for quit diary, which was not relevant for the quit smoking records to be kept in the clinic. Pages 7 and above were actually follow-up consultations pages, and these were also eliminated. However, they were replaced with pharmacist record from the Garis Panduan Pharmacoterapi Berhenti Merokok, which is more up-to-date and comprehensive for follow-up consultations records. Ladies and gentlemen, let me introduce to you the flow of our quit smoking clinic in Klinik Kesihatan Buntong. First of all, the areas of opportunity to recruit clients for quit smoking clinic would come from OPD patients, chronic diseases patients, patients with tuberculosis and retroviral diseases, patients from medical camps, as well as BSSK screening, referrals from government organizations, school, as well as private clinics. These patients are then seen by the doctor, whereby the doctor would take complete history, perform physical examinations, conduct some baseline blood investigations, as well as ECG, chest X-ray, as well as peak expiratory flow rate. They would then be taught by the nurse on how to perform CO reading using the CO analyzer, and after that, the patients would then be experienced and would know exactly how to measure their own CO readings using the CO analyzer during each clinic visit. All follow-up visits, which includes counseling with or without pharmacological intervention, are conducted and done using multidisciplinary team approach. As you can see in the picture, the patient is seen by the doctor as well as by the pharmacist and by the nurse, all in one clinic setting. Our pharmacists would then go on and continue to provide counseling on specific and detailed pharmacological managements, which would also include on troubleshooting on any side effects of medications if there were any. This is the result of using of our My Q-CIG when we compared with the old record book, whereby work processes for initial consultation using the old record book had 2 extra steps when we compared with the work process for initial consultation when we use My Q-CIG, whereby we now dropped off separate documentation and interview by the doctors and pharmacists, and we have merged documentation by the doctor and the pharmacist into one same document or record, which is the My Q-CIG book. This is also the same for the work process for follow-up consultation, whereby when we compare the old record book with My Q-CIG, again we have dropped work process, whereby there is no more documentation individually by the doctor and the pharmacist, and these documentations and interview are actually merged together into the My Q-CIG. Time taken for initial and follow-up visits, pre-intervention and post-intervention were measured from the record books in the clinic. A total of 9 patients were taken from July to September 2019 and were compared with 9 patients taken from July to September in 2018. For pre-intervention, July to September 2018, the mean time taken to see new patients recruited from registration until the end of consultation for initial visit and follow-up visits were measured. For post-intervention, July to September 2019, the mean time taken to see new patients recruited from registration until the end of consultation for initial as well as follow-up visits were measured. This is the chart for pre-intervention old record book initial visit, whereby the mean time taken for every visit recorded was 101 minutes. However, post-intervention using my Q-CIG for initial visit, the mean time taken was only 76 minutes. Therefore, ladies and gentlemen, the comparison of time taken pre and post-intervention clearly showed a reduction of mean time by 25 minutes. This is the chart for pre-intervention using the old record book for follow-up visits 1, 2, and 3. And the mean time taken for each visit was 43.7 minutes. When we compared with post-intervention using the MySIG, the mean time taken for each visit was only 30 minutes. Therefore, comparison of time taken pre and post-intervention clearly showed mean time reduction by 14 minutes. This proved an overall increase in productivity of the quit smoking clinic, whereby more patients can be recruited and treated within the same clinic duration. Our quit rate of quit smoking clinic in Buntong Health Clinic 2018 and 2019 also showed a marked increase from 2018, whereby the total clients who quit smoking in 2018 was 26 and increased to 31 patients in 2019. Our quit rate also increased from 72.2% to 77.5% in the year 2019. The cost for the production of each copy of My Q-CIG is also very minimal, whereby each copy is only Ringgit Malaysia 1 ringgit and 50 cents. The additional cost of photostat copies of pharmacist records merged into the old record book, which used to be RM 275 ringgit, estimated for 500 new patients recruited per year, can also be saved by using My Q-CIG. This is the picture of the storage space of the old record book, ladies and gentlemen, whereby, as you can see, it appears to be very cramped, messy, untidy, and does not fulfill the EXA criteria. By using My Q-CIG, the storage space is saved, it's neat, tidy, organized, and fulfills EXA. I now come to the discussion, ladies and gentlemen. All the objectives of the production of My Q-CIG was achieved. My Q-CIG has been updated with all the relevant information needed, and it is more accurate, comprehensive, compact, efficient, and user-friendly. There is now no longer duplication of data and records between the doctor and pharmacist. There is also no more time wastage for data recording by the doctor and the pharmacist into two different records. The cost of production of each copy of My Q-CIG is also very minimal. Photostat copies of the pharmacist record sheets are also no longer needed, which leads to overall cost savings. The storage space is also proven to be saved, neat, tidy, organized, and fulfills EXA. The Quit Smoking Clinic team of Buntong Health Clinic had applied and obtained the copyright voluntary notification from My IPO on the 3rd of March 2020. My Q-CIG product has been replicated, printed, and distributed for use to all districts in Perak, and has also been distributed for use to private agencies as well, which included Hospital Pantai Ipoh, KPJ Ipoh Specialist Hospital, and UITM Cawangan Perak. We have received numerous positive feedbacks post using My Q-CIG from the health facilities using this product. Our team from Buntong Health Clinic has also written to the Family Health Division in Ministry of Health Malaysia to request for national accreditation and to be considered to expand the usage of My Q-CIG to all health facilities in the whole country when we are running and conducting our quit smoking clinic services. This is the picture of our copyright voluntary notification certification from My IPO for our My Q-CIG. Ladies and gentlemen, I would now like to conclude to say that My Q-CIG has certainly proved to be an excellent and efficient record to be used in all quit smoking clinics. It can certainly increase productivity, whereby number of clients recruited into the clinics can be increased and more effective treatment can be delivered to all clients via multidisciplinary approach. This eventually can increase the quit smoking rates, which will benefit clients and the community collectively. Our team would like to acknowledge Dr. Umi Kalsung, our Deputy State Health Director of JKN Perak, as well as Dr. Asma, our District Health Officer from PKD Kinta Perak, for their enormous support throughout our innovation project of My Q-CIG. Thank you.